Have you ever felt a slight pain in your lower leg, especially around the calf area, at the end of a day, and thought it was just tiredness or maybe the result of standing up for too long? Maybe you even assumed it was just a harmless cramp, the kind that bothers you for a while and then goes away. But now picture this. That same seemingly innocent pain could actually be the first sign of a life-threatening condition. Alarming, isn't it? I'm sharing this because I've had many patients come into my office convinced they were just dealing with sore muscles. And once we started examining more closely, what we discovered was deep vein thrombosis. That's a blood clot forming quietly inside a deep vein in the leg. And at any moment, it could dislodge and travel to the lungs, leading to a pulmonary embolism. In that scenario, the chance of surviving drops drastically. Do you know what's most concerning? The majority of people simply ignore the early warning signs. They think it's just a passing discomfort, something that will improve on its own. And I get it, life is demanding. There are appointments, children, jobs. But let me ask you an honest question. Have you been really listening to your body or just pushing those symptoms aside? What worries me most is how the pain from a thrombosis can resemble other common types of pain. It can feel like muscle soreness after a busy day. It might come across as mild pressure, a strange discomfort, or a sense of heaviness in the leg. Sometimes, a person might even notice warmth or redness on their skin, yet they still don't recognize the seriousness of what's happening. The worst part? Thrombosis can progress without any obvious signals. Often, the first major symptom is the embolism itself, when the clot has already left the leg and reached the lungs. And at that point, time is your enemy. One of my patients, a 45-year-old attorney who led a sedentary lifestyle, spent 2 entire days working on a major legal case without getting up from his chair. He told me he only got up to use the bathroom and eat. On the 3rd day, he woke up with an uncomfortable pain in his calf. He assumed he had just slept in a bad position. Later that same afternoon, he suddenly had trouble breathing. At the hospital, we diagnosed him with a pulmonary embolism caused by deep vein thrombosis. He made it through, but only just. And here's something surprising. Many people believe this only affects older individuals. But thrombosis doesn't target only the elderly, especially if someone is exposed to risk factors like long periods of immobility, excessive weight, contraceptive use, or a family history of clotting issues. In fact, according to the International Society on Thrombosis and Hemostasis, 1 out of every 4 cases occurs in people younger than 40 years old. Can you now see why I'm always stressing this topic? Have you ever taken a moment to think about how many hours a day you spend sitting? Do you work in front of a computer? Spend more than 2 hours watching television or scrolling on your phone without standing up? Do you drive to work, sit all day, drive back, and then slump onto the couch in the evening? Research indicates that sitting for more than 4 consecutive hours raises the risk of developing thrombosis by as much as 35%. This is because blood flow slows down and pools in the veins of the legs, and this stagnant buildup increases the likelihood of clot formation. It's as though you're unintentionally setting up the perfect environment for a hidden threat to quietly take hold inside your body. And when we talk about thrombosis, time becomes a critical element. The earlier it's diagnosed, the greater the possibility of a successful treatment and the lower the likelihood of serious complications. That persistent little pain you've been brushing off might actually be a warning sign from your own body, and ignoring it is no longer an option. I'm not here just to frighten you without reason. I'm speaking up because you deserve to live in good health, with awareness and control over your own choices. Disregarding what your body is telling you is a bit like trying to drive with the handbrake on. You might still move forward, but eventually the engine is going to burn out. The encouraging part is that all of this is preventable. You can avoid it. And it all starts with something as straightforward as paying closer attention to your own leg. So let me ask you this. How many times have you felt pain or swelling in only one leg and simply decided it was nothing? How many times has your body cried out and you chose not to respond? If that sounds familiar, maybe this video is exactly the signal you've needed to take action today. The choice, as always, is entirely yours. When thrombosis comes up in conversation, most people imagine a clot stuck in place, clogging a blood vessel. But the real story is much more involved, and understanding it could transform how you look after your health. Back in the 19th century, a German doctor named Rudolf Virchow identified 3 main conditions that, when combined, create the ideal breeding ground for the formation of dangerous blood clots. Those 3 components became what we now refer to as Virchow's triad. And even though this theory was developed more than 150 years ago, it still provides the foundation for everything we know about thrombosis today. The first part of the triad is known as endothelial injury. But what does that really mean? Think of the endothelium as a thin, fragile lining that coats the inside of your blood vessels, much like a delicate carpet covering every internal surface. When that carpet is damaged, even on a microscopic level, your body sees it as a threat. And in defense, your biological system leaps into action, producing platelets and fibrin to form a clot and plug the hole. The trouble begins when, in some cases, that clot doesn't stop growing. That's when the conditions for thrombosis are set. This can result from physical trauma, like a blow to the leg, recent surgery, or even from tiny injuries caused by ongoing inflammation, smoking, or certain infections. The second key element of the triad is called blood stasis. This is one of the most common factors I encounter in clinical practice, precisely because it's so easy to overlook. Have you ever stayed still for hours on end? Sitting on the couch, watching television, traveling, driving long distances, or being confined to bed due to illness. When your body remains still for extended periods, the blood in your legs begins to slow down. And the slower it flows, the higher the chance it will pool in specific spots and turn into a clot. I often compare this to traffic. When the road is empty, cars move along effortlessly. But if there's an accident or some kind of obstruction in that spot, everything comes to a standstill. It becomes a full-blown traffic jam. That's exactly what happens inside your bloodstream. In fact, something that really stood out to me recently came from a study indicating that watching television for more than 4 hours each day can raise the likelihood of developing thrombosis by as much as 35%. And this isn't because the television itself is harmful. It's because people who watch for such long periods tend not to get up, hydrate, or move their legs. This kind of silent sedentary behavior is one of the leading enemies of good blood circulation. The third and final contributing factor is what experts call hypercoagulability, meaning the blood becomes more prone to clotting. There are many reasons this can happen. Some are genetic, such as a mutation known as factor V Leiden, which increases the risk of clot formation. I remember a particularly striking case in my clinic. A young man, just over 20 years old, suffered a pulmonary embolism. We investigated and found that he had a twin brother, and this brother had experienced a thrombosis as well. Not long after, their sister, who wasn't a twin, developed the same condition. All of them carried the same genetic mutation. That shows how sometimes danger quietly runs through a family, only becoming visible when a serious symptom appears. In their case, they will have to take blood thinners indefinitely, perhaps for the rest of their lives, unless medical science advances enough to offer a permanent solution, maybe through CRISPR gene editing someday in the future. But hypercoagulability doesn't only arise from genetics. There are other circumstances that thicken the blood, such as dehydration, certain autoimmune disorders, hormonal treatments like birth control or hormone replacement therapy, and even the use of specific medications. Cigarette smoking is another contributor, because beyond inflaming the inner lining of blood vessels, it changes the properties of the blood, making it thicker and more viscous. That's why if someone smokes and also takes hormonal contraceptives, for instance, the danger multiplies. It's important to highlight this. That combination has already led numerous young women, including some well-known public figures, to develop blood clots. There's a difficult truth that many people prefer to avoid. A large portion of our health issues doesn't stem from outside elements, but rather from the choices we make or fail to make on a daily basis. When it comes to thrombosis, this becomes even clearer. The modern way of life, filled with conveniences yet dominated by inactivity, has become a breeding ground for vascular diseases. And the most alarming part is that, in many situations, the source of the risk is staring us right in the mirror. Have you ever looked at yourself in the mirror and asked honestly, am I taking care of my body the way it deserves to be treated? Because let's be honest, habits like lack of physical activity, unhealthy eating, carrying excess body weight, smoking, constant stress, and poor sleep are not just small things. These are direct triggers for inflammatory processes inside your body. And inflammation is one of the main factors leading to clot formation. Obesity, as just one example, isn't merely a cosmetic concern. It's a quiet and dangerous ticking time bomb. Excess body fat, especially the kind that accumulates around the belly, releases pro-inflammatory chemicals that make the blood thicker, impair the vessel's ability to function, and slow down blood circulation. All of this creates favorable conditions for clots to form. On top of that, extra body weight puts physical pressure on the veins in the legs, making it even harder for blood to return to the heart. And when that happens, clots find the ideal conditions to emerge and grow. Now let me ask you something. How many people do you know who spend their entire day sitting? Whether it's in front of a computer, behind the wheel of a car, or lounging on a couch watching television. Our modern lifestyle has locked us into a state of near-permanent inactivity. We sit to work, we sit to eat, and we sit to entertain ourselves. But the human body wasn't designed for this. We were built to move. Healthy circulation depends on physical motion. With every step we take, our calf muscles contract and push blood upward toward the heart. If you stop moving, this natural pumping system also stops. Blood flow becomes sluggish, and once again, the risk increases. But it's not just about physical habits. What we eat plays a crucial role as well. Diets high in saturated fats, refined carbohydrates, and highly processed foods promote inflammation. This inflammatory state, in turn, not only worsens existing conditions like high blood pressure and diabetes, but also directly supports clot formation. What you put on your plate affects more than your waistline. It changes the structure and behavior of your blood. Now think about this with me. Are your food choices helping or harming your blood flow? Do you drink enough water during the day? Or do you go hours without hydrating? Because when the body is dehydrated, the blood becomes thicker and more viscous. And yet again, the chances of developing a clot increase. I know that changing habits is hard, but I also know it's worth the effort. I've witnessed patients with a very strong family history of blood clots who were able to completely turn things around with a few simple changes. They lost weight, started walking daily, improved their eating habits, and gave up smoking. Within a few short months, their test results showed a remarkable improvement in both systemic inflammation and vein function. If you're still not convinced about how much lifestyle choices affect your health, let me remind you of a real-life case that shook the sports world. Serena Williams, one of the greatest tennis players of all time, experienced a pulmonary embolism in the year 2011. Yes, a world-class athlete at the peak of her physical condition. But after undergoing surgery and spending some time resting, she started experiencing pain, swelling, and difficulty breathing. The diagnosis? A blood clot that formed in her legs and traveled to her lungs. She almost lost her life, and that was with full access to elite medical and physical support. Now imagine what could happen to someone who doesn't have access to cutting-edge medical care or detailed knowledge about these risks. That's why I'm telling you, the real danger might be hiding in your everyday habits, closer than you think. That choice to stay just a little longer on the couch, to skip that glass of water for now, or to eat anything just because you're in a hurry. Those decisions may seem harmless in the moment, but they accumulate over time. Eventually, the consequences might come in the form of a blood clot, a hospital admission, or even something worse. Yet, this is not a punishment. It's a signal. It's also a moment full of potential. Because when you start recognizing these recurring behaviors, you gain the ability to make a significant shift. And the earlier that change happens, the greater your chance not only to prevent thrombosis, but also to enhance your overall well-being, your life quality, and how long and how well you live. So if today, when you glance at your reflection, you don't see the healthiest version of yourself, it's okay, as long as you choose to act from this moment forward. Health isn't about being flawless. It's about making consistent progress. It's about the choices you make. Every minor habit matters. Each glass of water, each stroll outdoors, every better balanced plate of food. These are your way of telling your body, you matter to me. And believe this, your body will hear you and respond in kind. Being able to spot the signals your body sends can be the defining line between survival and loss. That is not an exaggeration. One of the most common and heartbreaking mistakes I see in my practice is when someone arrives at the hospital in a critical condition and says, "I did feel something unusual, but I figure it was nothing serious." Sadly, this is something that happens far too frequently with thrombosis. The warning signs aren't always loud or dramatic. They show up subtly, quietly, almost hesitantly. And because of that, they often get dismissed. But listen carefully to what I'm telling you now. This could genuinely save your life or the life of someone close to you. When we talk about deep vein thrombosis, the body sends clear distress signals. It tries to communicate. It's asking for help. And if you can catch these signs early, you can prevent a clot from making its way to your lungs, where it could cause a pulmonary embolism, a dangerous and potentially fatal complication. The most classic sign is swelling. Usually, it appears in only one leg, and that distinction is crucial. If both legs are swollen, the cause is likely unrelated. But if it's just one, especially the calf area, be alert. That swelling might also be accompanied by a lingering pain that doesn't get better with massage or rest. It's the kind of pain that makes it uncomfortable to walk or to stand still, the kind that has you constantly shifting to find relief. This discomfort is sometimes mistaken for a muscle cramp or soreness. And that's where the real danger lies. Because the person decides to wait it out, and it never goes away. The longer they delay seeking help, the greater the risk that the clot breaks free. On top of that, the skin in the area might turn reddish, feel warm when touched, and even appear shiny and tight. That leg may start feeling unusually heavy, as though something extra is weighing it down. Many patients describe the sensation as a localized fatigue that just won't subside. Some also experience tingling, numbness, or notice that surface veins are becoming more pronounced, almost like they're stretching outward through the skin. In more advanced stages, the body may even show a low fever, an inflammatory response triggered by the developing clot. If at any moment a person starts experiencing shortness of breath, chest pain, a racing heartbeat, dizziness, or feels like they might faint, then the matter becomes even more critical. These are clear indications that a clot may have moved and reached the lungs, what we refer to as a pulmonary embolism. In such cases, every single minute makes a difference. It's not an exaggeration to say you must head to the hospital right away, because when this happens, the risk of serious complications, including death, increases drastically. The biggest challenge here is that many people are unaware of this. Or worse, they might know, but refuse to believe it could ever happen to them. They assume they're too young, too healthy, or simply too busy. But let me ask you, how many stories have you heard of people who seemed fine and suddenly had a major health scare? The human body doesn't scream without warning. It whispers first. It gives small signs. And those who learn to listen to these whispers can avoid ever having to hear it scream. I once had a patient who ignored swelling in her left leg for several days. She thought it might be due to the heat or maybe from standing for too long. She only sought medical care when the pain worsened and breathing became difficult. She was diagnosed with a pulmonary embolism caused by deep vein thrombosis. She came very close to a tragic outcome. After the incident, she told me, "If I had known that swelling could mean something so serious, I would have gone to the doctor on the very first day." That's exactly what I'm trying to prevent with this video, for you to be informed, to recognize the danger, and to act. So if you're dealing with a persistent pain in one of your legs, especially if there's swelling, redness, or a heavy feeling, do not minimize it. Don't tell yourself it's just fatigue. Most importantly, don't delay. Go to the doctor. Ask for a venous Doppler scan. It's a straightforward, painless, and highly effective test to detect thrombosis. And if needed, begin treatment immediately. Early diagnosis changes everything. Now tell me, do you know someone who has complained about leg pain but never investigated further? Someone who spent several days, maybe even weeks, with one of these symptoms and thought it was nothing? Share this message with them. Because sometimes a simple video can inspire someone to take a step that might save their life. And what about you? Will you wait, or will you finally listen to what your body is trying to tell you? If there's one thing you must take from this message, it's that leg pain should never be ignored, especially when it comes with swelling, redness, a feeling of heaviness, or trouble breathing. These subtle signs might be your body's only warning before something truly dangerous happens. The sooner you notice, the better your chances of acting in time and preventing severe outcomes, like the dreaded pulmonary embolism. And if this message made sense to you, then it's time to take the next step in your journey toward a healthier life. The next video on your screen will guide you on how to do just that, with practical advice and information that will build on what you've learned today. Thank you so much for staying with me until the end. I'll see you in the next video.